Okay, welcome to part 3 of the phonation unit. So in the previous unit, in the previous section of this unit, we discussed overall the process of phonation, and we looked at the kind of generally the components of the laryngeal system overall, and also some of the slightly touched upon the dynamics of phonation, and go back to section 1 and you kind of refresh and review the information before you come to section 2. So in this section we're going to speak about the muscles. Now that we discussed the skeletal framework, we're going to discuss the muscular system. So as we have explained in the class, this is how the larynx is positioned in the neck, and these are your vocal folds. The only air that can get into your respiratory system is between the vocal folds, nowhere else. The only other possibility is when someone swallows air through the esophagus. It goes into the stomach, and that air gets out as a burp. So that other than that, that's it. And we discussed how the inside of the larynx is structured with the glottis, the space between the vocal folds, and the supraglottic cavity, and the infraglottic cavity, or the subglottic space below the glottis. So we have now the larynx, and there are two sets of muscles. There are one set that is made out of 8 muscles, and these muscles maintain the larynx up straight in the neck and support it. And these muscles together, they can elevate the larynx, they can elevate it and pull it a little bit forward, or depress it, bring it down. So these muscles that can do this movement are called the extrinsic laryngeal muscles. Extrinsic, obviously, because they have to do something with the outside, and that thing is that their origins are outside of the larynx and their insertion is onto the larynx itself. So as compared to the intrinsic muscles have both the origin and insertion on the larynx itself, or within the larynx itself. The extrinsic laryngeal muscles support the larynx within the neck. They do not directly contribute to vocal fold vibration. Now, what about the intrinsic muscles? The intrinsic muscles, their function is to act on the arytenoids so that they can swing them to the midline to bring the vocal folds together, to adduct the vocal folds, or to rotate the arytenoids laterally so that they can bring up or can abduct the vocal folds. The vocal folds cannot adduct or abduct themselves. Another function of the intrinsic laryngeal muscles, in addition to that, is that they can adjust they can adjust the length of the vocal folds. The vocal folds themselves can contribute to lengthening and shortening through mechanisms that we are going to describe here. So vocal fold adjustment, vocal fold adduction and abduction are all performed by means of intrinsic laryngeal muscles. So it is very important to understand these differences, all these differences between extrinsic and intrinsic laryngeal muscles. I use the acronyms DSMG, and when we look at the extrinsic laryngeal muscles, we divide them into two sets. 4 muscles that are above the hyoid bone, and 4 muscles are below the hyoid bone. And we said that the hyoid bone is the bone that is horseshoe shaped with the closed end facing front, and the entire larynx is attached to it. That little structure that is about the size of a quarter, it serves as the point of attachment for many muscles. So the muscles that extrinsic muscles that are originate above the larynx are called the means above, the suprahyoid muscles. And the extrinsic muscles that originate below and then go up to insert into the hyoid are called infrahyoid muscles. So you notice now, as I mentioned before, in many cases you have the muscle made out of two names combined together. The first part of the name refers to the origin of the muscle. The second part refers to the insertion. Why is this important? It is because the way that the muscle fiber is oriented, it is going to contract only toward the origin, only towards its root. So if you know the name and the clue in the name, you are going to understand in what direction will the muscle will pull. And in this way, how will the organ move, in what direction it will move. That's a very important principle. So as you notice now, you have the clue, SMG, all of these three muscles, they end with the hyoid. That means they all originate somewhere else and insert onto the hyoid. The digastric, as I explained again in class, it has two bellies, one anterior and one posterior, and then the anterior comes in as it approaches, it originates within the inferior anterior margins of the chin and the chin bone, and then as it comes in close to the hyoid, there is a little tendon, ligament that is shaped like a tunnel, like this, opened like a string, shaped like a tunnel. And then as the anterior belly of the digastric comes close, approaching that little ligament, it's going to go underneath it, but it changes it into a tendon itself. So it goes under and it shows up on the other side. On the other side, there's another piece that is originating somewhere else from above and coming down, and then the two tendons are connected, and now you have the anterior belly, you have the posterior belly of the digastric. If this one contracts, it's going to pull up and forward. When you swallow, this is what it's gonna do. Swallow, and it's going to pull a little bit forward so that it can protect, give some extra protection for the vocal folds and the larynx to be away as you swallow. Because the epiglottis is sitting like this, the larynx is here, and when the epiglottis closes, then you give some extra protection. Push the larynx forward and up so that it will have extra protection. In addition, you also adduct the vocal folds always when you swallow, so you have double protection. And then the stylohyoid and the mylohyoid and the geniohyoid. DSMG, again, remember from the DSM, the famous Diagnostic and Statistical Manual of Mental Disorders, and language, but the language disorders are all listed in that manual, so it's important for us as SLPs. And then the G, so DSMG. So let's look at them here. Here's the digastric muscle. Di means two or double. Gastric, it has to do with belly. It means the double-bellied muscle. So this is the anterior belly, and it is, both sides, of course. This is the anterior belly originating onto on the inferior surface of the chin bone, and then going down, and then and then going down. You can see the tendon here, and then the muscle, the ligament, sorry, and then the muscle itself, as it approaches, it now changes into a tendon, and it goes under that little tunnel made by by that ligament, and it shows up on the other side as the posterior belly of the digastric. So it is like almost like a hammock, you know, and when they imagine this side and this side and this side, and they all contract together, and in that process they just lift up the larynx. DSMG, what does the S stand for? Okay, it stands for the styloid process. See this little tip of bone here? It is a very important piece, and it's called the styloid process. And out of it, there are three muscles that originate on it. The one inserts onto the hyoid bone, stylohyoid. One inserts onto the posterior segment of the tongue, and that's called the styloglossus. One originates there and inserts onto the pharyngeal muscles. That is called the stylopharyngus. So three muscles. So now our focus here is on the one that's an extrinsic laryngeal muscle, particularly an suprahyoid. So stylohyoid. You could imagine now how it works. It comes at an oblique angle, slanted like this. So when it pulls, it's going to pull toward the styloid process. So it's going to pull back and up, back and up. And of course, there are two of it, one left and one right. So it's going to, again, pull back and up. This is the muscle that is going to enable you to say sounds like ooh. So when you say ooh, your tongue goes way back and goes way back, I mean up and back. And that is the major contributor, you know, toward this is the actually the styloglossus. Sorry, the styloglossus muscle. But in this case here, the stylohyoid elevates the larynx. So all the suprahyoid muscles, they elevate the larynx. And the anterior belly of the digastric, left and right, also pull the larynx forward a little bit. And then you can imagine now the infrahyoids, because their origin is below, they are going to contract and pull back the larynx, pull it back down. Like after you swallow, when you swallow, the larynx is lifted up. When it relaxes, then after the swallow, it goes down. But it might not go down all the way. So the infrahyoids are going to ensure that they anchor it back down. DS and then M. The M stands for the mylohyoid. Mylo has to do with the jaw. See, the boundaries of the mandible here, the inferior lateral margins of the mandible give rise to this muscle, mylo, and the muscle is triangular in shape. So the fibers course medially and posteriorly, as you could see, medially towards the middle and posteriorly going back. And there's a mid line here where the right side is separated from the left side. So then it inserts, this muscle inserts onto the hyoid, the anterior segment of the hyoid. So when it contracts, it's going to elevate the hyoid. Again, the mylohyoid. So now we have D, digastric, S, stylohyoid, and the M, mylohyoid, and then G, geniohyoid. The word genio is the origin for the word chin, and it comes from Latin, means basically the chin bone. So you could see it here, and you could see it one second. So you could see it in this image here. It is beneath. It is, or if you, in order to view it, you have to peel the anterior belly of the digastric, and you have to peel the mylohyoid, and then you will see this muscle here that is the geniohyoid muscle. So again, you have to cut the anterior belly of the digastric. You have to cut through the mylohyoid, and then you'll see the geniohyoid. So it is closer to the tongue from inside of the mouth, and it goes from the interior surface of the chin bone, and it courses posteriorly and inferiorly a little bit to insert onto the hyoid bone. So geniohyoid. Okay. Now, this is a summary of these muscles, and you could see in this website, you have more information about this these muscles. So there's a lot of information here and animations, and I recommend that you visit that and do some practice. Okay, so now let's look at the infrahyoid muscles. And I kind of created this acronym too, called, TOS or TOS. Okay, and here you have your visual cue. So the infrahyoid muscles, all of them, again, they are extrinsic laryngeal muscles, and they have their origin beneath the hyoid bone, and their work is to depress the larynx. And the first one is the thyrohyoid, and then the amohyoid, sternothyroid, and then the sternohyoid. So out of the sternum, we have two muscles originating and coursing superiorly to insert onto the thyroid and to insert onto the hyoid, and then the amohyoid, and then the thyrohyoid. So let's look at them. So earlier I didn't have this image, so you could see the extrinsic laryngeal muscle, which is the geniohyoid. You could see after you peel the anterior belly of the digastric, you peel the mylohyoid, then you can now see the geniohyoid. But now let's look at the infrahyoid muscles. Here is the amohyoid, see, amohyoid, and it has two bellies. So it goes up, and as it reaches the level of the clavicle, it's going to change into a tendon. So you have an inferior belly here of the amohyoid, and then above that tendon it has a superior belly of the amohyoid, and it inserts onto the hyoid bone. Again, the action is to depress the hyoid. So TOS. We said thyrohyoid. That means thyroid and then hyoid. So it originates onto the lateral inferior margins of the thyroid cartilage, and inserts onto the lateral inferior margins of the hyoid bone. Again, upon contraction, it is going to pull down the hyoid. TOSS, and then the SS stands for sternum. And the part of the sternum that gives origin to these two muscles is the manubrium of the sternum. So first one is, we said, sternothyroid. So you could see that muscle here, sternothyroid. It originates on the lateral superior margin of the manubrium, and then it courses superiorly to insert onto the inferior lateral margins of the thyroid cartilage. And then when it contracts, it's going to depress the larynx. The other muscle, sternohyoid, is kind of, it covers it, and it originates on the lateral margins of the manubrium and courses superiorly to insert onto the lateral margins of the hyoid bone. And again, upon contraction, it's going to depress the larynx. So now, let's look at the intrinsic laryngeal muscles and exactly how they function. We'll spend a lot of time, more time on them. These are divided into three groups. The abductor muscles, abduct, open, and the adductor muscles to close, bring the vocal folds closed, and then the adjusters to make them higher pitch or lower pitch. So let's take them one by one. First, let me ask you this question. Are the vocal folds at rest, when you are at rest, are the vocal folds abducted or adducted? That is a very, very important question. So when you are breathing, when you are sleeping, or not just simply breathing, your vocal folds must be adducted. I'm sorry, I made a big mistake. Abducted, wide open. Because that's your airway. If they are closed, that means they are not breathing. So that means their rest position is when they are swung wide open. That means when you want to bring them against the rest position, you have to put a lot of energy to bring them, to the midline like this. And then that means the next thing is when you bring them and adduct them like this, all you need to do is to just relax the muscles that are holding them adducted. Once you relax, the vocal folds will swing back again to the open position. However, because that is your airway, you cannot just leave it for chance, because they might swing back, but they might not go all the way back. What if you are running and you want them to be swung farther back so that you can get more oxygen in? These muscles of abduction are going to, put some more effort and pull them farther back. So there is a single muscle that is paired left and right that is responsible for abduction. And why do we have one single muscle that is the major abductor of the vocal folds, and why do we have several muscles that are adductors that close them? And again, that is because it is like bringing rolling a boulder uphill. That is when you adduct, when you bring the vocal folds together, you put a lot of effort, like bringing that boulder uphill. Once you bring it uphill, all you do, just give it a little push, and it's going to roll down with no effort. It will land at the bottom of the hill. So that muscle is called the posterior cricoarytenoid muscle. I cannot emphasize enough how important it is to name the muscle precisely and to make sure that you put every single part of the name correctly. So if you tell me the cricoarytenoid muscle abducts the vocal fold, that does nothing at all. It gives you absolutely no credit. It's like having two Samantha or two Sarahs in the class, and then I say, who made the announcement? And you say Sarah. How helpful is that? I mean, I have two Sarahs in the class, sometimes even three Sarahs. So it doesn't help me. You need to tell me the full name to distinguish, this Sarah from the other Sarah. So in other words, there are several muscles that would have one name in common, and then you have to describe, is it the anterior one, is it the posterior one, is it the lateral one, and so on. So you need to really make sure when you say this muscle, the abductor muscle, it is the posterior, and then cricoid arytenoid muscle. And the origin, I'm going to so here is you have a posterior view at the larynx, and you can see the back of the cricoid cartilage, the signet portion, and you can see the line of symmetry. And on the right side, you could see one side of the cricoarytenoid muscle. And on the other side, you could see the other side. So because now this is on back of the cricoid, cartilage, we call it the posterior cricoarytenoid, posterior crico, and then arytenoid. It originates on the posterior lateral lamina of the cricoid cartilage, and it courses laterally and superiorly to attach to the muscular base of the arytenoid cartilage, which is like, when you have a pyramid like this, it attaches on the lateral tip of that pyramid, and then when it contracts, it's gonna swing it away, because each arytenoid is connected to a vocal fold. When you swing, pull this and swing the whole arytenoid away, the vocal fold is taken away from the midline. So that would be your muscle posterior. Add the word posterior here, cricoarytenoid muscle. And the origin of it is, the innervation comes from cranial nerve number 10, which is the vagus nerve. There's a branch of it that's called the recurrent laryngeal nerve, and it innervates the posterior cricoarytenoid and many other muscles. So this is another view. You need to really pay attention to this image. It shows several muscles. This is another view now that you have. This is the white piece in the back here is the part of the cricoid cartilage, and as you keep going around, that is you are looking at it from the top, all this cricoid cartilage. Here are the arytenoid cartilages. One is here. Oh, sorry. Okay, so one is here and one is here. So now the arytenoid, like I said, has like a pyramid shape. It has on the side here, that is one side of the arytenoid. This is one side of the other arytenoid. That is the muscular base. So now this muscle in the back of the cricoid cartilage, that is the posterior cricoarytenoid. Posterior cricoarytenoid. And you can see how it attaches to the muscular base of the arytenoid. So when this muscle contracts, it's going to kind of rotate the base of the arytenoid. By rotating it this way, it's going to send it away from the midline. You can see the vocal fold is attached to it, and the vocal fold will swing open, and the other side will do the same. Now the next muscle, you saw that in the video, and you also, if you play with this, it's gonna show you how all of them behave, all of these muscles. Let's see. So there's a Um, in this mode, it doesn't seem to give me. Okay, let's see if this doesn't. Transverse. Okay, they changed the site a little bit. So if you want to see the action of the transverse arytenoid, for example, see, it's the one between the arytenoids. Arytenoid muscle, that is the only one we call it the transverse, means horizontal, and it connects one arytenoid to the other, and you can see the action contributes to compressing the vocal folds together. Let's look now at the muscle that closes the vocal folds, that adducts. It's the major adductor of the vocal folds. So again, lateral cricoarytenoid. So now you could understand why I'm telling you to really focus on the names. If you say the cricoarytenoid muscle does this and that, again, you haven't done anything now, because there is a lateral cricoarytenoid, there's a posterior cricoarytenoid. So let's see how it works. So when it contracts, let's go here. Number one, it originates on the lateral superior margins of the cricoid cartilage. When it contracts both sides, it's going to pull the muscular base, it's going to rotate the muscular base of the arytenoids medially, and that is going to bring the vocal folds to the midline. And you can see it right there. And the point of attachment of the lateral cricoarytenoid is exactly opposite, is exactly across from the posterior cricoarytenoid. So the posterior cricoarytenoid is in back here of the arytenoid. You don't see it because you have a superior view now. But when it contracts, it will be pulling this end this way, and it will be rotating the arytenoids, rotating them away from the midline. So in other words, the lateral cricoarytenoid muscle reverses the action of the posterior cricoarytenoid, and the posterior cricoarytenoid reverses the action of the lateral cricoarytenoid. So you go down here, you can see now the posterior cricoarytenoid. This is a superior view, like I showed you in the image on the slides, the last one. So here it is. Do not be deceived by it. So watch. See, when it contracts, it's going to reverse the action of the lateral cricoarytenoid, because they are both inserted on opposite ends of the muscular process of the arytenoid cartilages. Now you could see now, these are the vocal folds themselves. These. So we are going to discuss the structure, but you can play with this and see the vocalis muscle, thyrovocalis muscle, and see how it works. Now, actually, this will be the, there's something wrong here. This will be the thyromuscularis will do this action. I'll tell you what the vocalis does. Okay, cricothyroid, cricoid, thyroid. Watch, this one is the anterior muscle that elongates the vocal folds by tipping the entire thyroid forward and down. Watch. See? When it contracts, and like we saw in the video in the class. Alright. So there are many resources over there, and you really need to practice and review frequently so you can do well. So again, on this image, here's the posterior cricoarytenoid. Across from it, here it is, and across from it is the lateral cricoarytenoid. And this lateral cricoarytenoid is going to contract and rotate the muscular base of the arytenoid, and by doing so it will rotate the entire arytenoid medially, and both of them do that, and they bring the vocal folds to the midline to adduct them. And then the posterior is going to contract bilaterally, and then it will swing the lateral base away laterally from the midline to open the vocal folds, so to abduct the vocal folds. The transverse arytenoid is a muscle that is the only unpaired muscle, originates on either side of the arytenoids, and then when it contracts it just brings them closer, as you saw. There are two other muscles that are X-shaped here. You do not see clearly in this image. They are called the oblique arytenoids, but we'll come to them in a few minutes. So now we spoke about the muscle that adducts the vocal folds, and the muscle that abducts the vocal folds. So the adductors, first one, the most powerful, is the lateral cricoarytenoid that we discussed. The second one is called the transverse arytenoid, that connects both, the arytenoids together, and when it contracts it brings them, approximates them close to the midline. So the oblique arytenoid is an X-shaped muscle, and the way it works, let's see if I have. Okay, let me explain it. Go back to an image of the I might. Okay, I don't have a very good image of it. Sorry, I had to go back and forth, but this is what happens here. You have two arytenoids sitting across from each other. One muscle, the oblique, originates on the muscular base of one arytenoid and courses upward to insert onto the apex, the very top of the other arytenoid. So this will be like this. So originating on the muscular base of one and inserting onto the apex, onto the very top of the other one. And the other muscle does the same. Originates on one side here and then courses to insert onto the apex of the other one. So now you have the two arytenoids like this connected, with the base of one connected to the apex of the other, and the opposite is true. When both of these contract, they are going to pull the top of the arytenoids closer together and the bases of the arytenoids closer together. So in addition to the transverse muscle that is lying posterior, see, you could see it behind that X-shaped muscle behind the oblique. That's the transverse. So both of them together, they contract, and then they now hold the swing the arytenoids together and hold them. Because when you phonate, you need to hold them like this. So they, in addition to being muscles of adduction, they are muscles of they are also muscles of compression. They hold, like if you want to push and resist, they hold the vocal folds so that the arytenoids don't swing open again while they are doing this. Okay, so we discussed all of this, and now So all of them are innervated by the cranial nerve number 10, the vagus nerve, by a branch from the vagus nerve called the recurrent laryngeal nerve. So now, as I mentioned, you're going to, you need to understand the questions of how to raise pitch and how to lower pitch. Very critical questions. So vocal fold adjustment, it means you can adjust the length, the thickness, and by doing so, we are going to adjust the vibration rate, the pitch. So the tensor muscles, number one, are the thyrovocalis, and then the cricothyroid muscle. And then relaxers are the thyromuscularis. I don't know, this might not mean as much, but let's just look at them in context. This is the cricoid cartilage. This is the thyroid. So if you look at this muscle now, it makes sense. The first part of the muscle, it originates on the cricoid, inserts onto the thyroid. So we call it simply the cricothyroid, because there is no muscle like it, in the back or sides. We just simply call it the cricothyroid. We understand because it's just a simple muscle that there's no other one like it, that it is in the front. So it lies on the front here, anterior, on the anterior surface. So this muscle is the primary one that is responsible for raising pitch, cricothyroid. The other one that contributes to raising pitch is the vocal fold muscle itself. The vocal fold muscle has two strands. One of these is called the thyrovocalis. So that thyrovocalis contributes to raising pitch, contributes to raising tension, and by doing so, it raises pitch. So again, two muscles, and I left one here intentionally, left it out, so you can fill it in, okay? So here is the cricothyroid muscle. Understand its origin. It originates on the superior anterolateral margins of the cricoid cartilage, and it courses superiorly and laterally to insert onto the inferior lateral margins of the thyroid cartilage. As you could see, one is here, one is here. Actually, each branch has two segments, but I'm not gonna have you worry about this. Just know as cricothyroid. Now, when this muscle contracts, you could see the action in the two videos we have shown. It is going to tip the thyroid forward and down because of the shape of the thyroid. So forward and down. And you could see it here, and that shaded, that means that is the action of the cricothyroid muscle. So it pulls it forward, and see, it creates space down. Okay. Now, because the vocal folds originate on the anterior surface of the thyroid, inferior to or below the thyroid notch. Because of that, when the thyroid is pulled forward and down, what will it bring with it? So it's going to bring with it the vocal folds. So the vocal folds are going to be pulled forward and down, and that extends their length by adding up to 20% more length to them. Remember, when you spread the length out, you make them thinner. you make the mass lighter per square inch. So this way, once you elongate them, you have changed their vibration characteristics. You have made them vibrate faster, which is a higher pitch. So the steps again in sequence. When you explain this, please do not give me acronyms unless you are going to name something more than once. So you first begin and say the cricothyroid muscle. If you tell me the CT, it means nothing. You have to say the cricothyroid muscle. If you want to mention it again and then later, yes, you say the cricothyroid muscle, parentheses, CT. And then from now on, I understand that you will mention it again. But to just begin like this without naming it, it means to me that you are not certain, that it is easier to remember CT, but I need you to know the full name. So the cricothyroid muscle contracts. When it contracts, it's going to pull the entire thyroid cartilage anteriorly and inferiorly. Two movements. Because the vocal folds originate on the anterior surface of the thyroid, beneath or below the thyroid notch, below this end here. When the thyroid is pulled forward and down, it will pull with it the vocal folds. And by doing so, this action increases the length of the vocal folds, and it makes them thinner, and it makes them have more tension, and it makes them vibrate at a faster rate. So the increased tension of the vocal folds is going to make the mass decreased, which means they are lighter, and then they will vibrate at a faster rate. And while this is the step that you are going to add, while the thyroid is being pulled forward and down by the cricothyroid muscle, the thyrovocalis segment of the vocal fold tenses itself, holds back, and is going to resist the pulling. So it contracts. As it contracts together at the same time as the cricothyroid, it is going to stiffen the vocal folds even further. It will make the tension even more. So remember to mention the contributions of the thyrovocalis muscle. I've told you here, so you need to add it. The let me go back and explain both of them here. Actually, I need to have a bigger image. Where is it? I know I have one back there. Here. So these muscles, as I explained a couple of minutes ago, this is the anterior surface of the thyroid cartilage. This is where the thyroid notch would be. Again, remember the thyroid notch is a space. Nothing can attach to a space. So the vocal folds originate below the thyroid notch within the anterior surface of the thyroid. Each one courses posteriorly to insert onto one arytenoid. The arytenoid has two places called processes. One is called the muscular process. That muscular process is the anterior side, where one part of the vocal fold attaches. This is the muscular process. And then the other side is the vocal process, this frontal part of the arytenoid. So this is the vocal process. This is the vocal process. So now look at the muscle itself. You will see a clear line in the middle. These are actually two separate muscles. They are connected together, joined in, laterally together. But both of them make up the vocal fold. But both of them also behave in a different way. So the muscle that is closer to the glottis is called the thyrovocalis. Why vocalis? It vocalizes. It is the muscle that's responsible for vibration. Okay, again, the thyrovocalis is one branch of the vocal fold. The other branch that is anterior, that is away from the glottis, that is the bulkier, heavier muscle, that is called the thyromuscularis. So it originates in the anterior surface beneath the the thyroid, beneath the thyroid notch, and courses posteriorly to insert onto the muscular process of the arytenoid cartilage. The thyrovocalis originates in the same point and then inserts onto the vocal process of the arytenoid cartilage. So both of them are joined laterally. Okay? So, again, just to emphasize, this whole piece that you see on one side, that is called the thyroarytenoid. Thyroarytenoid. That's the vocal fold, one vocal fold. So one vocal fold has two strands of muscles. One is the one that is closer to the opening, to the glottis. That's called thyrovocalis. The one that is more inward is called thyromuscularis. Both of them are joined in the middle, laterally, all the way. So now let's go back and see what how each one contributes to adjusting pitch. So we explained the action of the thyroarytenoid. Now we look at the thyrovocalis. Let's look at the thyromuscularis and how it adjusts for lower pitch. So the thyromuscularis again originates on the anterior inner surface of the thyroid cartilage, immediately beneath the thyroid notch and lateral to the vocalis, next to the vocalis muscle. It inserts onto the muscular process and the base of the arytenoid. When it contracts, the medial fibers contract. It's going to make the distance between the arytenoids and the anterior part of the thyroid closer by basically pulling a little bit on the arytenoids and making the space, bringing the arytenoids closer a little bit. By doing so, the muscularis relaxes the thyrovocalis. Thyrovocalis doesn't do anything, but because this one contracts and because this one is joined with it laterally, when this one contracts to shorten, it will shorten the other one, whether it is, it wants it or not. So here's how, this is the mechanism to lower pitch. Again, this is thyromuscularis. When it contracts, it pulls the arytenoids forward a little bit, and it shortens the distance now. It shortens the vocal folds. When you shorten the vocal folds, you make them bulkier, you make them heavier. When you do that, they will create that, they will vibrate at a lower rate, and lower rate vibration, that is lower pitch. So these are the steps. The medial here, the middle fibers of this muscle, thyromuscularis, contract. And that is going to shorten the distance between the arytenoid and the anterior segment of the thyroid cartilage. Because the thyrovocalis is laterally joined with the thyromuscularis. When the thyromuscularis contracts and shortens and becomes bulky, the thyrovocalis also is made to bunch up and to be bulky and to be heavier, to be shorter. Now remember, I did not say that it contracts. The thyrovocalis does not contract when you are lowering pitch. The only muscle that is responsible for lowering pitch is the thyromuscularis. And why is it able to act on the thyrovocalis? It is because the thyrovocalis is laterally joined with the thyromuscularis. So if the thyromuscularis shortens, it is going to shorten with it the thyrovocalis. And that is what, this exactly says. And remember again, do not use acronyms. I use acronyms, to simplify things for you and me to explain things. But when you in the exam, you need to spell things out, please. So here are the conditions. You need to really understand this process of what muscle, is responsible, and step by step. If you switch the steps, that is going to produce a whole different action. And then the sequencing is a big part of the answer. So now let's look at the histology of the vocal folds. Histology is tissue analysis. Let's kind of, we have a vocal fold and we dissect through it and open and see the layers, layer after layer. So the vocal folds are positioned like this. You see it, superior, like when you look at them, like from a superior view or from an inferior view, you see them like this. Now, if you see them like this, and you actually slice through them, you can see them in a transverse form. However, if you imagine them like this, and then one vocal fold as it comes close to the other one, look at the glottis in between, then when you kind of look at them this way at an angle, they will be like what you see in the picture here. So we are not looking like lengthwise, you are looking at a cross section of both of them. So this is a vocal, this is the glottis, this is one vocal fold, and this is the other. The top layer of the vocal fold, each one, is called the epithelial membrane. So this is epithelium, very like the lining of inside of your cheek. It is when you look at the vocal folds, as you saw in the video stroboscopy, you could see that rubbery surface that is kind of undulating as the vibration goes on. It is very soft and transparent kind of layer that is stretchy and rubbery, and it contributes significantly to the vibration. So that is the epithelium or epithelial layer, okay? And then when you cut through it, beneath it, you are going to find another structure. That structure itself is made out of 3 layers, but the whole structure that you could see here, it is called the lamina propria. Lamina propria. So the lamina propria is made out of 3 layers. One is called the superficial lamina propria, that is very stretchy and kind of rubbery, a little bit more tense than the epithelial membrane. And then as you go down, you have the intermediate layer. That's more like very stiff, and it doesn't stretch as much, but it does stretch, but not as much as the layer above it. And then you go to the deeper layer that's called the deep lamina propria. That deep lamina propria is more like cotton threads. You pull and it gives you a tiny bit of pull, but it doesn't stretch much. It is stiff. So if we look at individual layers now, how many layers do we have? The epithelial membrane, the superficial lamina propria, the intermediate lamina propria, the deep lamina propria. 4 layers. Then beneath the lamina propria layers, you have the actual bulk of the muscle that we know as the thyrovocalis. So instead of looking at it this way or this way, you have sliced it, and you are looking at it in a transverse way. You see the bulk of the muscle here. So again, epithelial membrane, superficial lamina propria, intermediate lamina propria, deep lamina propria, and then the thyrovocalis. 5 layers. 5 layers of the vocal folds. Now pay attention to this. The 2 layers of the vocal folds that are responsible for most of the vibration, guess what they are? The epithelial membrane and the SLP, not the speech language pathologists. The ear, nose, and throat surgeons sometimes refer to this. Okay, I'm going to cut through the SLP, and you'll be sitting there at the conference. So, the superficial lamina propria and the epithelial membrane together, they are responsible for most of the vibration. They are right there near the opening of the vocal folds, the glottis. And because they are soft and gelatinous and rubbery, the air pressure is going to blow them apart and then vibrate them. Now, pay attention more. The intermediate and the deep layers of the lamina propria, they make that whitish, can you see that white kind of line here? That is the combination of the intermediate lamina propria and the deep lamina propria. That is the vocal ligament. The vocal ligament. It's tough, like very, very tough thread, and it is stretched. You know, it's inserted on both sides, just like the vocalis muscle, and it gives bulk to the vocal folds, and it supports them like almost like a bridge, and it makes them not collapse. So it's a very and it is very important for vibration. The what do you call it? The vocal ligament. Okay. So here again are the layers, and the simpler way to do it, to list all of them and discuss them, is say simply make them 5 layers: the epithelial membrane, the superficial lamina propria, intermediate lamina propria, deep lamina propria, and the thyrovocalis muscle. These are all the components of the vocal fold, you know, from top to bottom. And you could see now here more clearly, here is the, you could see one vocal fold, another vocal fold. Take this and expand it and enlarge it. You can see the epithelial membrane, the superficial lamina propria, and the intermediate and the deep. These 2, intermediate and deep, give you what? The vocal ligament, right there. And then the inside, the core, that is the muscle, thyrovocalis muscle. That's the part of the vocal fold that is responsible for the vibration, and that is the summary of the phonation process and how the vocal folds are adducted and how they actually vibrate. So I hope that you take good notes and take good questions, And if there's anything vague or anything that you have a question about, I'll be happy to answer it. Just make sure to study everything thoroughly. Thank you. Bye.